Welcome to myTRIAList Trial Talk, Voices of Experience.
I didn't know that it was going to stop my family life. Like, I'm 34 years old and I want to be a mom. And I didn't know that it would stop me from possibly, I could, well, it's not really stopping me, but if I tried to conceive, obviously it could be detrimental to the child. So I think I would have waited or planned it out better had I known that part. Other than that, the clinical trial is pretty good. Another thing is some of the side effects, like I go through side effects where I'm in pain. Like if I miss a dose or get close to the dose being due, the pain, it hurts to blink. Like I can't make this up. It hurts to blink. It hurts to speak. I can't even lift my hand up without everything feeling like it's about to shatter. That's one of the things about the clinical trial I wish I would have knew. But other than that, we figured out ways to figure that out and get that under control. So that's pretty much it on that end.
The main side effect that I have is that first of all, I can't take this drug. I have to fast for a minimum of 2 hours before I take these drugs. And for me, these are pills that I take every day. And then I can't eat for another hour. And these drugs are a little hard on my stomach, and my stomach has to be empty. So I have that, whatever that sort of stomach disruption is when you take a medicine that's hard on your stomach. Sometimes antibiotics are that way. That's what I experience, and it's more or less daily. However, I've discovered that it's not daily, but it's frequent. I've discovered that since I already get up in the middle of the night to use the bathroom, that's a perfect time, and then I go back to bed. I can take this drug at 4 a.m. or 3 a.m., go back to sleep, and then sleep through the period of time that it takes for the drug to be to process into my body. There's some better way to say that, but I don't know what it is. And then I wake up, and then whatever side effect I've had, which I probably have had, I don't know because I slept through it. So and so that works really well for me. It might not work for everyone to get up at 3 o'clock in the morning and take a pill, but that, as it turns out, is something I can do from time to time. In fact, right now I have a little bit of skin dermatitis, a little red patchy stuff but this is the first time, but I've actually my dosage has been accelerated. So I'm taking more than I was taking earlier on this trial. So it was likely that the side effects might increase. And so I have a little bit of dermatitis.
Being a chef, being on my feet 10 hours a day, I just didn't have the oomph that I used to have. And I was getting slower and slower. It was affecting how I was breathing. They were having me on steroids. I had gained quite a considerable amount of weight. If you look at a picture of me 3 years ago, I was 200 pounds. Now I'm almost 300. But also, too, the weakness and the fatigue started to really set in November. I do have pain all the time, but not as much suffering. And they've made it tolerable. And they're doing the best that they can do. And with a trial, that's what you have to be optimistic about. That, instead of being maybe 21 months, maybe you can stretch a 5-year stint out, maybe even longer.